Last year, poisoning deaths became Dane County's #1 cause of injury-related deaths, with 2/3 of those deaths due to drug overdoses.
That's why heroin use and the problems surrounding it are becoming the focus of a city and county-wide opiate action plan. And joining us tonight to tell us more about it are Dane County Executive Joe Parisi and Cheryl Wittke from Safe Communities. Nice to see you both. Thanks for being here. Joe, let's start with you. And is there any way to explain how serious this problem is in Dane County now?
Well, if you look at just prescription drugs, there were nearly 500,000 emergency room visits last year in Dane County from prescription drugs. And when you look at opiates, they're both prescription drugs all the way up to heroin. And what we're seeing is that prescription drugs have become the gateway to the heroin epidemic that we're seeing also. But one of the things we're focusing on today, and some of the things we were talking about, is the prescription drugs and just how dangerous they are also.
Cheryl, talk about this program, the MedDrop program. It's been successful and now it's expanding.
That's right. We have 4 boxes currently in Dane County. As of the end of the week, we'll have 10, which is really largely due to the partnership with not only local law enforcement, but the county and the city providing funding for that.
And how does it work? How does that work?
Well, basically, you can bring medications to your local police department. They're on our website, the locations, and you drop off your medications and they're safely disposed of in an environmentally friendly manner. And that way they're out of the house, because we know that about 70% of folks who abuse drugs get them from someone that they know.
And Cheryl, as far as dosing goes, we've talked to doctors as well about just how much prescription medication to prescribe over the years here.
That's right. A big part of the initiative is working with the medical community, and there's a wonderful partnership forming to talk about how do you make sure that we're not, sort of putting too many medications out there in the community. All of us have had the experience where maybe you go to the dentist or the doctor, you really need maybe 2 pain pills and you get 20. Well, there's lots of reasons for that, but the medical community is going to work across to find out how to resolve it.
Well, sometimes you think if some is good, then more must be better. But
That's right.
Heroin, Joe, is a totally different situation. Isn't it related, but I would think a trickier problem to solve.
Yeah, it's really scary, and once you're addicted to heroin, it's really a difficult drug to kick. And what we're seeing is it's not just, sometimes there's a stereotype that heroin abuse is something that just happens in urban centers, but really it happens across the board, across the county. And when it usually makes headlines is when someone from more rural parts of the county come into Madison to buy heroin, and they actually shoot up in their car and start to drive home and get in an accident. And unfortunately, we've seen more and more of that occurring.
Why is that? Is it cheaper than other street drugs, or what do you think is causing this?
Yeah, heroin is cheap, but it's also incredibly addicting. And again, it comes back to the whole issue of the connection between prescription drug addiction, opiates addiction, leading to heroin addiction. Because what we see, again, the prescription drugs are a gateway, and people get addicted to this, then they can't find anymore, they can't get a hold of anymore, but they can find heroin. Then they turn to heroin as the next step because they're hooked and they need that fix. And it's cheap, and unfortunately it's not difficult to find.
And a complex problem overall. Hopefully the MedDrop program, the expansion, could help with all this.
Takes a village.
Yeah, absolutely. Thank you very much for joining us tonight.
Good to see you guys.
Thanks,
Thank you.